Heart disease. Heart disease refers to a range of conditions that affect the heart structure and function. Common types include coronary artery disease, heart failure, arrhythmias, and valvular heart disease. Risk factors include high blood pressure, high cholesterol, smoking, obesity, and a family history of heart disease. Maintaining a healthy lifestyle with regular exercise, a balanced diet, and regular checkups can help reduce the risk of heart disease. If you have specific questions or concerns about heart disease, feel free to ask. Heart disease causes. Heart disease can have various causes, often related to a combination of factors. Here are some common causes and contributing factors. 1. Atherosclerosis. This is the buildup of plaque, cholesterol, fat, and other substances in the arteries, narrowing them and reducing blood flow to the heart. Over time, this can lead to coronary artery disease. 2. High blood pressure. Uncontrolled high blood pressure can damage arteries and make the heart work harder, increasing the risk of heart disease. 3. High cholesterol. Elevated levels of LDL, bad cholesterol, can contribute to atherosclerosis. 4. Smoking. Smoking is a significant risk factor for heart disease because it damages the blood vessels, reduces oxygen in the blood, and increases the buildup of plaque. 5. Diabetes. People with diabetes are at higher risk of heart disease due to elevated blood sugar levels that can damage blood vessels. 6. Obesity. Being overweight or obese increases the risk of heart disease because it can lead to conditions like high blood pressure and diabetes. 7. Family history. If close family members have a history of heart disease, your risk may be higher due to shared genetic factors. 8. Physical inactivity. Lack of regular physical activity can contribute to obesity and increase the risk of heart disease. Chronic stress can have adverse effects on the heart, increasing the risk of heart disease. A diet high in saturated and trans fats, sodium, salt, and added sugars can contribute to heart disease. Drinking too much alcohol can lead to high blood pressure, cardiomyopathy, and other heart-related problems. The risk of heart disease increases with age, as arteries naturally become narrower and less flexible. Men are generally at higher risk of heart disease than premenopausal women. However, the risk evens out after menopause. This sleep disorder, characterized by interrupted breathing during sleep, is associated with an increased risk of heart disease. Conditions like chronic kidney disease and certain autoimmune diseases can also raise the risk of heart disease. It's important to note that lifestyle changes and medical treatments can often mitigate these risk factors and help prevent or manage heart disease. Regular checkups with a healthcare provider can assess your risk and provide guidance on prevention and treatment. Preventing heart disease involves making healthy lifestyle choices and managing risk factors. Here are key preventive measures. Eat a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy. Limit saturated and trans fats, cholesterol, sodium, salt, and added sugars. Control portion sizes to maintain a healthy weight. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity exercise per week. Include strength training exercises at least 2 days a week. Losing excess weight, if necessary, can reduce the risk of heart disease. Don't smoke. If you smoke, quitting is one of the most important steps to reduce your risk. Limit alcohol. If you drink alcohol, do so in moderation, usually 1 drink per day for women and up to 2 drinks per day for men. Manage stress. Practice stress reduction techniques such as meditation, yoga, or deep breathing exercises. Regular checkups. See your healthcare provider for routine checkups and screenings to monitor blood pressure, cholesterol levels, and blood sugar. Manage chronic conditions. If you have conditions like diabetes or high blood pressure, work with your healthcare team to manage them effectively. Medications as prescribed. If your doctor prescribes medications, example, statins, blood thinners, take them as directed. Sleep well, aim for 7 to 9 hours of quality sleep per night. Limit processed foods, reduce consumption of processed and fast foods, which can be high in unhealthy fats and salt. Stay hydrated, drink plenty of water instead of sugary beverages. Know your family history. Be aware of your family's history of heart disease and share this information with your healthcare provider. Stay informed, keep up to date on the latest heart health guidelines and research. Remember that prevention is a lifelong journey, and it's never too late to start making healthier choices. Consult with a healthcare provider to create a personalized plan based on your specific risk factors and health needs. Dietary treatments. Dietary treatments for heart disease primarily focus on reducing risk factors and improving heart health. Here are some dietary strategies that can be effective. Mediterranean diet. This diet emphasizes olive oil as the primary fat source. Plenty of fruits, vegetables, whole grains, and legumes. Moderate consumption of fish and poultry. Limited red meat consumption. Nuts and seeds as snacks. Red wine, in moderation. Diet. Dietary approaches to stop hypertension. This diet focuses on low sodium, salt intake. High intake of fruits, vegetables, whole grains, and lean protein sources. Low-fat dairy products. Limited sweets and sugary beverages. Reduced saturated and trans fat intake. To lower cholesterol levels, choose lean cuts of meat and poultry. Use healthy cooking oils like olive or canola oil. Avoid trans fats found in many processed and fried foods. Limit sodium, salt intake. Reducing sodium can help lower blood pressure. Avoid adding extra salt to meals. Check food labels for sodium content and choose low-sodium options. Increase fiber. Fiber-rich foods can help lower cholesterol. Include whole grains, oats, fruits, vegetables, and legumes in your diet. Omega-3 fatty acids. These can benefit heart health. Include fatty fish like salmon, mackerel, and trout in your diet. Consider fish oil supplements if recommended by your healthcare provider. Portion control. Pay attention to portion sizes to manage calorie intake and maintain a healthy weight. Limit added sugars. Reduce consumption of sugary snacks and beverages. Alcohol in moderation. If you consume alcohol, do so in moderation. Excessive alcohol intake can be harmful. Stay hydrated. Drink plenty of water instead of sugary beverages. Plant sterols and stanols. These can help lower LDL, bad cholesterol, and are found in some fortified foods. Meal planning. Plan your meals to ensure they are heart-healthy and balanced. It's important to note that dietary changes should be made in consultation with a healthcare provider or a registered dietitian, especially if you have specific medical conditions or dietary restrictions. They can provide personalized guidance and create a diet plan tailored to your needs and health goals. Additionally, combining dietary changes with other lifestyle modifications and, if necessary, medication as prescribed by your doctor can be an effective approach to managing heart disease. Subscribe to our channel, Healthism, for expert insights, practical tips, and the latest trends in wellness. Discover ways to maintain a balanced lifestyle, improve your fitness routines, and make informed decisions about your health. Join our community and embark on a journey towards a healthier, happier you.